Can a single device truly predict if a patient is going to be hospitalized 7 days in advance with 92% accuracy? Remote monitoring system has been popping up left and right. However, the functionality, the practicality has been limited. At the same time, how do we confirm these are the true, accurate data point that can confirm our questioning process as a clinician to ensure to decrease costs, decrease hospitalization for patients with acute and chronic diseases? Today, we'll be tackling these challenges. Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. Hi, I'm Sabrina, your host of Provider's Edge. As you know, we love to cover some of the most innovative space, especially in the conference event in healthcare. And there are so many of them, and it can be confusing and hard to decide even which conference you need to show up. So we did some coverage at ViVE, one part of the Health USA group, and we recently attended Health as well. Two of the founders we have spoke to tackling what really connect with them is how do we predict patients that has chronic diseases and able to decrease amount of hospital visits that they will have to endure and with 7 days notice. So then you can do something about it. And then the second solution that we interview is in-home testing. I believe sometimes we heard a lot of devices, a lot of similar arena, but accuracy is always the challenge in order for all of us as clinicians, as investors, as hospital organizational administrative to truly believe in those solutions and push things forward. So first up, let's hear from Sathya, who has a personal connection to taking care of mom who has chronic diseases and seeing a gap on how can we have a simple, even breath analyzer to measure 10 critical vital systems, including lung function, that can predict 7 days in advance with 92% accuracy with the data points that they have collected. Listen up.
Hi, this is Sabrina Runbeck with the Caregiving Worldwide Network here at ViVE. And then I'm here with Sathya. You're the president and the CEO of Aidar. And please share with us what is the mission behind you guys' solution and how are you uniquely solving a problem in the healthcare space?
Absolutely. Thanks for having me. As you mentioned, like in healthcare, we have a lot of problems, especially when it comes to managing chronic condition. Everyone thinks it's much more easier problem because chronic condition is impacting like more than half of the US population. I'm one of them struggling to manage my mom's health and as a caregiver. And for me, 10 years ago, when I first thought about it, I really wanted to make a difference so that I can prevent my mom from getting back to the hospital. And that's what led us to build this device. It's called MouthLab. It's more like a breathalyzer. The user holds the device, places it in the mouth, and breathe through normally for 30 seconds. At the end of 30 seconds, they perform lung function tests. So essentially, within a minute, the device measures around 10 health parameters like temperature, ECG, oxygen saturation, heart rate, lung functions, everything, all within that minute. And that data is actually sent to our secure HIPAA-compliant cloud. From there, the data is sent back to the patients and more importantly to the caregivers so that they can actually monitor and see the gradual worsening of health of their loved ones at a very early stage. So that's what we've been doing. And thankfully, this device, after almost 6 years of work, we got our FDA clearance, CE mark approval, ISO and MDSAP certifications. And now we are in the market helping not only patients, but also their caregivers.
That's amazing. Definitely when we order these lung function tests before people go into surgery or for us to evaluate them for some capacity, it's taking a long time to get those studies done, where you have to go to a pulmonary lab, or the tech have to roll the big machine to the patient's bed, and they, based on their condition, really sitting up. All these complicated things to just get some numbers that we can see how well the lung function is, so we can risk stratify on all this other modality. You guys come up with something that has multiple different elements of vitals that are truly impactful from the caregiver clinical side to make the right decision. And now also as a family member, the caregiver side, they also start seeing the trends and differences on alerting them to say, when is your mom, your child, your loved ones really needed to get more of alert, to get attention, versus they seem to be fine, quote unquote. So what have been some of the biggest wins you guys have created so far?
Yeah, I think for us, when we thought about this, we're collecting information from the mouth through breath, saliva, lips, and everything. There's always been a challenge, like how are we going to achieve that? So it took a lot of work, like almost 10 years of work in terms of getting these things. And today this device is fully FDA cleared, so which was a big win for us. So we helped us to go into the next stage. But also the next step is, like, as a caregiver or physician or even the patient, right? If you have multiple parameters, you tend to not understand, or like sometimes it's overwhelming. So what we did was last year, we did a study, like a clinical trial with over 200 patients with the VA health system, to actually build an algorithm that can actually give you more like an index, like a simple number that tells you where you are to where you're going in terms of your health. So look at this more like as your body compass, right? Like finely tuned to what you're doing, how your health is, so that it tells you where you are. And essentially, this device is used to personalize care. So patients, when they start using it for a couple of days, we actually create a more digital fingerprint of this patient or person. And then they start using it every day. We just tell them, okay, here's your index, which translate to like your overall health on that day. So that data, we were able to get like around 92% accuracy, sensitivity, and specificity in terms of predicting an hospitalization or an ER events at least a week in advance. So that's the data that we actually submitted to the FDA for an additional clearance under the software as a medical device submission. So we're waiting for that. And then once we get that clearance, that'll be a breakthrough, not just for us, but also in terms of healthcare community, because nobody has so many biomarkers put into one algorithm. On top of it, it also is a nice thing for patients so that they can look at their daily index to understand how well their health is progressing or deteriorating.
Exactly. It's about, yes, we can have all this data, but what does the data mean to us? And then you guys find out a new way to give a score, a number, so they can see the shifts going, trending in the positive direction or the negative direction. So you can do something with the data and then become more alert to seek help. And the impactful side of what you're saying, 7 days ahead of time, that is amazing. We can really reduce the cost for both the patient and caregiver side, and also the burden as a healthcare system overall.
Absolutely.
Now, what have you guys been leveraging as your go-to-market strategies to truly put the right solution to the right hands so they can gain the impactful ideas of the mission behind this device?
Absolutely. No, for us, one of the bigger things is like AARP is our investor and supporter. So we are actually hoping that is one way of like actually reaching the target audience. But also in the past few months, we've been getting a lot of inbound requests from nursing homes where there are a lot of patients and then their caregivers, like they put their loved ones in the hospital or in the nursing home, but they find it very difficult to understand what's happening with their health, and like they cannot be with them always. So which is where our device act as a way to communicate, like digitally communicate about their health. So every day, like nurses can take this device to different patients within their nursing home, take measurements, all the data is sent to the electronic medical record, like within a second, like, so the information is there. And also, but then these information are also translated back to the caregivers so that they are actually monitoring. There's like different level of let's say authentication that is there, but then caregivers can get like those notification. So today, because of all those inbound requests, we're already looking into all these nursing homes. We're putting in a nursing home, senior living facilities, assisted living facilities, all those areas where multiple patients are there, very limited nurses are there, but they need like higher level of care. Our device comes in as more like a savior for them to monitor, predict deterioration of health. So that's what we are doing. And then we are taking different avenues to talk about this to different stakeholders to help them understand the value of it. We're also talking to some insurers to see how they can actually reimburse this device so that everyone who's like aging can actually use this device.
Right. There's a different facets. It seems like for you guys, the primary one is to go for the senior care facility first. And because they already have a cohort of population that really need this.
Exactly.
And helping their staff, especially when you have one person handling 20 patients, that is a whole lot of monitoring. And sometimes you actually don't get through all that. So be able to this device quickly to in those specific population, and then you guys start to expanding into other market avenues.
Yeah.
That's great because we all have to focus on something to get started and not trying to
do everything.
And sometimes they can be excited to want to do everything, but be able to be so focused. That is the amazing thing to drive changes. Now, if I can give you a magic wand, wave a wand, one big issue will be solved in your business, truly push this forward. What would you use the wand for?
I think for us, mostly like we have a lot of different other senses, because the reason why we actually built this device to collect information from the mouth is because of the access to breath and saliva. It's also considered as a mirror of the body, right? So right now we had like at least 15 to 20 other sensors that we already have. So our goal is these things are going to take a long time to actually get it validated, be in the system. So if you could give me that, like I would say just like get a clearance all at once, so that like this would be in the market faster for including all the other parameters. Not that this is already too much, but I think our mission is like to collect hundreds of thousands of health information rapidly so that we can provide a more holistic or 360-degree view of somebody's health. And that's where I would say like, not just like funding, but I think getting those additional FDA clearances would be help us to go a long way. And that's what I wanted to use it for.
Yes, so truly get validated FDA. So we have the stamp approval as a medical device to get it out there. People can actually use it for all the benefit that can have. Amazing. Now, we're at ViVE. People love conferences and there are always great energy around it. So what truly brought you to ViVE and what do you want to get out of it?
Yeah, I think for us, as I already mentioned, AARP is a great supporter, and they actually helped us to once go to Good Morning America show and then like present our technology. So they are the ones who are a catalyst to bring us here and then showcase our technology, showcase the work that AARP is doing to help aging population and their caregivers. So what we are here specifically is like also to spread the word, right? So we have been like, I would say for almost 8 years, we've been doing all these things, but then people did not really recognize or value the importance of daily monitoring or measuring multiple parameters at the same time. Now, this conference, I'm coming in with renewed energy and excitement because we have data to support. We have all the information, plus we have an FDA submission that's for our algorithm there. So we are talking about that. We are trying to understand like who are all the partners who are interested now. We are hoping to work with organizations like Best Buy and others where they are already getting into patients' home. They're trying to do a lot of things, but they always rely upon tools that are like wearables and the same kind of tools, same kind of things. So you can provide a lot more care, but if you don't have a holistic health information, it's going to be hard. So that's what we are trying to do is like spread that message, bring that awareness, and more importantly, also to bring like some sense of like, I would say like ownership, because although I talk about all these things, I lost my mom like just 3 weeks ago. So today I just look at it like I could have done a lot more to prevent her from like going and then like staying here. So which is why we want to do is like take this device, take our message and then spread it across. Make sure everyone realize the importance of daily monitoring, importance of giving just 1 minute of their day to get a comprehensive health assessment.
Yes, it's truly working out from your personal story, understanding the burnout caregivers, understanding the difficulty of the patient themselves who are in those critical conditions, and even those who might just need to know these data points so their clinicians can and the whole healthcare team can support them better, and really truly marriage all that together and give advice that's more competitive, more comprehensive than some other ones existing in the market. Now, how can people find out more about you guys and perhaps have a conversation with the right people?
Absolutely. You can reach out to me directly at ceo@aidar.com. We're also on different social media channels like aidar.health on Instagram or like Facebook. And you can also like go to our website. It's like aidar.com to find more information and reach out to me directly so that we can tell you a little bit more about what we are doing and also to see how our solution can fit into some of the amazing initiatives that people are doing.
Awesome. I so appreciate you for showing up and sharing your story with us.
Thank you so much for this opportunity. I think it means a lot for being part of the show and also to spreading the word. Appreciate it. Thank you so much. Yeah.
How did you relate to what Sathya said during his interview about the solutions? Would it be something that you can see your caregivers would be beneficial from using that with the patients that you even have or adapt into your system? Now the movement has been shifting a bit. We have been proactively seeing a lot of innovations in home care. And one of the area is lab testing. So we interviewed David White with IHD Lab to see how they can bring the easiness of not having to drive to a lab facility, wait for it, and get samples, but it's already simple and easy in your home. And that really complements it with the monitoring device sphere of if we detect something that's out of bounds, how can we confirm that diagnosis with additional testing at home before people have to pay a large sum money for hospital stay or waiting for hours at the ER? Now let's hear from David and his partner. Hi, this is Sabrina Runbeck with Caregiving Worldwide Network, and we're here at ViVE with Jim and David. Thank you for joining us. For sure, we wanted to hear more about your story of what's the true mission behind the company and what's the unique thing you're solving in the healthcare space.
Really fundamentally at its core, I think IHD's vision is about access to care. Even though we're a clinical lab and we, sometimes are seen to be in the basement of healthcare, we drive over 70% of all decisions that clinicians bring to patients. And so we really want to open that up with our at-home test offering in order to empower patients to be a part of their own care service processes and also to empower physicians to be able to access folks that might not be able to go into the brick and mortar.
Exactly. It's all about giving the power back to the patients and be able to easily accessible to these labs instead of having to drive somewhere and or sometimes the delay in even making those appointments. So now when you're thinking about really pushing this to the market and getting the right people actually adapt and use it, what is the best strategy you guys have been doing?
What we've noticed is that there's a lot of digital innovators out there. Who are young, digitally native, they're curious about their health and so forth. And so what we're seeing a shift away, more of like this co-adaptation of both the traditional model of medicine as well as this new age of delivering healthcare at home. And so we're seeing very much a push in the digital health space. Number one, we're seeing new players come in with newfound ideas that are perhaps disrupting the status quo. And what I think is eventually going to happen is we're going to end up with a hybridization of both traditional medicine and this new age cutting edge, at home, digital health space.
Do you see yourself more to or organizations make sure you're educating them properly so they can understand the value and deliver it at home or directly to the consumers so they can
ask the other way, asking the provider to say, hey, I'd rather have this at home. Just send me the kit so I can just follow instructions. Which way do you feel?
I feel it's a blended approach, and I feel that you see it on both sides of the equation. You see some brands that are really going towards the consumer market, and they might be giving information to the consumer that at a later point they need to act upon that with some additional resources, specifically a telehealth or another type of consultation. Or you might have other situations where you have the provider-driven engagement in which they come with an intent and they're providing a specific line of care. And so I'll give a little bit of an example. There's some brands out there that might do a fertility assessment, a battery of tests. They'll take the patient, they'll give them that information, and it's almost as if they're leading them to a cliff without knowing what to do with that information. They're not able to act upon it, and they might actually just feel frustrated and kind of worried, but they have that information in hand. So at least they can move to the next step. Other types of models, especially at the prep at home model, consumers are going with the intent to get specific testing the treat in order to be able to be prescribed the prep at home. Going back to that notion of the battery of tests for fertility, I have a personal story of one of my colleagues. We called upon fertility doctors for about 15 years together. IHD was really founded in the reproductive health space. Even though we were calling on doctors in the fertility space, she unfortunately wasn't able to conceive and didn't realize that it was a simple test, a AMH test, that was able to unlock her potential. We were down at a conference in San Diego. It was an embryology conference. She had a small cut that didn't resolve. Fast forward a few days later, she unfortunately found out that she had diabetes, was administered metformin as a treatment. And then forward a few months later to ASRM in San Antonio, which was a large reproductive health conference. She wasn't feeling well. We always loved to go to the pharma parties. She didn't want to go that day. She ended up stopping by a convenience store on the way home, or back to the hotel rather, and found out that she was pregnant through a pregnancy test. And we were trying to understand what had happened. And not only is it having access to the care and the diagnostics, is having information. And so you want to make sure that wherever this information is, once it's coming to the patient or the consumer, that it's able to be acted upon. And so sometimes I feel that we can do a better job of supporting on that consumer and that wellness model to make sure that the information they have can be acted upon. And so I think it's very important to have a provider or have some additional resources that you can use when you get that information from the diagnostic testing in order to act upon and make it a meaningful interaction with the information that you have in hand. So,
right. It's about that clarity. What do you do with the information once you have it? And then it can be confusing thinking about going to the consumer or educating the larger organization or physicians to adapt this. So if you have a magic wand, anything can be solved. What would be the one thing that need to be get out of your way for you guys to truly scale this thing up?
It's a very tough question. There's a lot. I would say that right now, there are two major barriers to access to care, right? So the one thing is the payer system right now. So a lot of this at-home testing model is cash. And, we have socioeconomic barriers within the country which prevent people from accessing this care. The payer systems have not caught up to this new model. And so therefore, you've got patients spending hundreds, sometimes thousands of dollars to access care. When in actuality, if the insurance companies and other payers embraced it, we could get greater access. That's one. Second thing, a little bit more out of our control, but still a big barrier is the logistics. The USA is a very large country. I come from Australia, so, we have really big geographic divides. So I share a similar sentiment here when I say that, logistical costs add significant barriers. So, you may be a laboratory in California, you've got a patient in Alabama, but just getting sample from point A to point B is quite cost prohibitive. So it's a challenge that we're constantly trying to tackle.
Exactly. It's both not just about having information, but the cost effectiveness of getting the information, and where patients don't leave with a big bill. And then they're like, okay, now that I have the information, now what? What do I do with it? So now we also understand, we love conferences. This is where the energy is. And we're all at ViVE. So what brought you guys to ViVE, and what do you truly want to get out of it?
Really, I see ViVE is an ecosystem, and it's almost a jigsaw puzzle. You have a lot of pieces of healthcare that are coming together, and you're able to fit the pieces together to solve the big problems. We as a laboratory, we can't do it without the physicians. We can't do it without the retail mail order pharmacies. And so I think ViVE is again, this opportunity for us all to come together to understand the big problems, take it from a different perspective, and bring our own talents, our own competencies into it, into the solution, and then really drive innovation and be able to deliver that to the consumer and to everyone out there that needs this critical access to care.
Amazing. And we definitely appreciate you guys are putting the front end of how do we leverage in-home testing for patients to get the right information and get things going. Now, how can people find out more about you guys and who would be the best people to connect them with?
So you can find us on our website at ihdlab.com. We're also fairly busy on our socials as well, Instagram, LinkedIn, and other various platforms. You could always just reach out by phoning us on our 800 line, which is also available on our website. So, yeah.
Appreciate you guys. Have a great event.
Thank you. Thank you. And thank you, everyone.
Thank you so much.
Today's two interviews really tackled on how do we bring access to the patient who are most needed. And sometimes if they don't know they need the help, they won't take action. So having a device that can predict 7 days in advance who can connect with clinicians to have that conversation, whether it's through app, telemedicine, to say what do they need to do next and not just rush into the ER. And because some patients simply don't have the ability of transport, and some people even refuse to go due to they might or might not even feel the symptoms. So if we can detect earlier and show them the actual data point, then we can verify. And the verification process, yes, in the device in itself, as Aidar showing 92% accuracy, and as well as what David had provided with IHD Labs, send the labs to home. How can we quickly then re-engage, confirm this process and testing, so then they're reducing a big trip hours away in the ER, was sometimes really difficult far away. And depending on how the weather plays into effect, then it's actually dangerous being on the roads in the wintertime, especially now. So it's more about giving power back to the patients, the caregivers, and also the clinicians ourselves. So as we are rushing, as we are already seeing a lot of patients on a daily basis, how can we be able to help those in the forefront without having festered their disease process into the late stage before they come to us? And that is the change in healthcare, the proactive way instead of reactive way. So in your practice, whether you are an innovator, a clinician, an administrator, or even an investor, which process in the healthcare system are you focusing on right now? Is it this forefront of preventative care? And how are you using it? Make a comment below wherever you're hearing and watching this, or post it on LinkedIn. Tag me, Sabrina Runbeck. I would love to continue this conversation with you. Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.